public. The last question is on a topic that I know you are very passionate about. I've seen some of your YouTube videos, which is on education and healthcare. These are two important areas where we definitely need government intervention, right? We just cannot rely on just the private sector alone. So again, I don't want to throw statistics on these two subjects. I'm sure you are better equipped than me. I would like to ask you to share your understanding of Bengaluru Central, right? Have you done any study on how many public and private schools we have in the zone? Are they proportional to the population and the economic strata of the society? What additional work do we need to do on the education sector? Will we ever see a day where the people in this room will be sending their kids to government schools? Right? Again, that's a question everybody wants to ask, but nobody asks. Similarly, on the health infrastructure as well, what is the primary, secondary and tertiary care setup that we have within Bengaluru Central constituency? Again, if you can throw some light on how much we have public infrastructure versus private, and then what additional infrastructure on the health sector needs to be done from our constituency, Bengaluru Central constituency.
Yeah, actually about education, that's I'm very keen. See, for example, a country like India, after independence, the first, we actually had hoped at that time that 6% of our GDP will be spent on education. No country can progress on, we say we will be a superpower, but when we say we will be a superpower, we are not willing to spend more than 2.4% of our GDP into education. Okay, because if India has to be a superpower, we need to get ready mentally, and all the, let it be any government at the center, that we should aim to reach. At least we should start by saying, okay, we are going to spend 4% of our GDP now again, and finally reach a level. Because again, this is education is a concurrent subject. It is both the center and the state. Okay. Again, I come back to your sharing of taxes, because if the center gives you more money, then the state will have more money to improve their school infrastructure. That is primary education infrastructure. Having said that, that's the space where a member of parliament can be a bridge between the center and the state. There should be a willingness to be the bridge. Sometimes there may be a situation at the center, there may be one government, state, there may be another government. So your art as a negotiator and art as how you want to play your role is very important. So there is no doubt there has to be more investment in the education sector, and very, very important. I'm not just talking about the infrastructure. You have finally the government may get, because today the situation is like some government schools are not even having a proper toilet and they can't afford to pay the building. But actually, we should get into a situation where we should be able to give a basic infrastructure. And one more huge thing India will face is the teacher shortage. I think some of our educators, like Noreen in the audience, I see they'll agree. We never focus and concentrate on teachers in India. That's one of the most important profession. You have a good teacher, then every other profession follows. So that focus also should be there. And it is, I have always felt, you said about in this audience, many people will want a central government school. Well, Kendra Vidyalayas can be excellent schools with the central government. I think the state governments also have to start working, and I think now every MLA is realizing that in this constituency there need to be better schools. So they are using a lot of public-private this thing and CSR funds all to improve the quality of schools. And hopefully that will happen. As far as healthcare is concerned, yes, still healthcare is an issue. Many people can't afford, and it has become a problem. It's very obligatory for the government to set up better hospitals, better scanning center, affordable prices. I think government of Karnataka has. Can you hear me?
Yeah.
At least government of Karnataka has started an initiative with 3 hospitals where the MRI and CT scans will be free.
Bengaluru Central?
Even in Bengaluru Central, one will that towards Gandhinagar one is coming, but more will be set up. And also in our manifesto, We have promised that there will be an insurance cover of 25 lakhs per family for the health sector.
Universal coverage or maybe?
No, universal. So I think you could see the accomplishment of this.